Okay, here with Bill Sullivan. Bill, give us a brief history as to what the extent of your injuries are.
I had a hip replacement to fix some injuries from a prior fracture. I had the hip replacement on June 2nd, 2010.
And this is to your...
To my right hip.
Right hip. Okay. You started physical therapy first inpatient, correct? I
was in inpatient rehab for 5 days from June 4th to June 9th. I came here on June 9th. Actually, I had outpatient starting June 9th, inpatient ending June 8th.
And this is your second time on the Alter G treadmill?
Yes.
Okay. So what we're going to do is we're going to start to remove his body weight, and we found out the other day that 49% seemed to be a pretty good place for him. You can put your arms on your side now if you want, supporting yourself a little bit. So we're at 30% first, and we'll go down a little more. Here's 50%, and we'll start the treadmill.
Here comes the treadmill.
We're at 0.7 of a mile per hour. How you feeling? Any discomfort?
I feel fine. I don't feel any pressure on my hip right now at all. I'm walking, but I don't feel any pressure on my hip.
That's great. We're at 50% of his body weight. So let's let him warm up first at this. And I'm going to examine your gait from behind now. Looking good, Bill. You can get up to the hip here as well.
I feel it working the muscles in my leg without really putting any pressure on my hip.
Say that again?
I can feel it working the muscle in my leg, but it's not really putting any pressure on my hip joint.
That's terrific. Great. Yeah, good range of motion, good blood flow. You can start to move your arms if you'd like, just to work them a little bit too. We were at 59%, yeah, almost 59% removed at one point. So at 50% now, it's an improvement in 1 day.
Yeah.
So you're on now for 2 minutes and 23 seconds, still at 0.7, and we'll check in with you in a moment. Okay, we're back with Bill. We're gonna juggle things a little bit. Let's go to 55% first and see. Any change there?
No, not really.
Okay.
So it feels pretty good.
And now we'll come up just a little more. So we'd have 40% of your body weight removed at this point. Any change there?
No, I'm still okay.
All right, good. We can pick up your speed just a little bit. You can go to 1 mile an hour. And let's see if that... How's that?
Let's go to, though, I can feel it affecting my gait a little more now.
A little bit? Okay, slow down. Let's go back down. You're at 0.8 of a mile an hour. Okay there?
Yeah, that's fine.
Now, obviously the surgery has, interrupted your daily activities and so on.
I had to have the replacement because of some problems with my hip that I had before that. Obviously, having hip replacement is significant surgery and requires therapy after that to get back in shape again.
Right. How's your experience on this machine so far?
This really seems to help. I'm now walking without having any assistance.
Right.
And I can feel it making my legs stronger.
That's terrific. Now, Rebecca, as a physical therapist, how do you think that the anti-gravity treadmill affects your treatment regimen on this type of hip replacement patient?
Okay, so here on the treadmill, he's able to walk without limping. He's able to walk for a longer time than he normally could if he had all of his weight down. So I like it to use it for endurance training also, just to get his body used to walking for 10 minutes at a time, whereas now without the machine, he can only walk for about a minute or two, and he has to sit down because he's too tired and too much pain.
So he's actually using some lung capacity, aerobic, building his aerobic capacity, increasing circulation and range of motion into his legs.
Right.
At fully weight bearing, but removing some of his weight. And the advantages of being able to observe his gait while he's on here is
Tremendous.
Yeah, invaluable, right?
Correct.
Now, how do you think the rehabilitation process is affected by this in terms of time, like compared to patients that we wouldn't have this technology for?
I'm hoping it's going to be shorter. I don't have to keep them here as long because, like I said, we can walk for 10 minutes and his muscles can be used to walking for 10 minutes, whereas at home he can only walk for a minute or two. So just the endurance factor itself, 10 minutes, buys you a trip to the corner to pick up the kids from the bus stop, or getting through the supermarket rather than not being able to do it at all.
Right, so the idea is if we can shorten the length of treatment, that affects cost and everything else.
And we can't speed up healing. That's never going to change. The hip's going to heal the way it needs to heal, but his rehab will be quicker because we'll be able to get him to walk more than he was able to walk before.
Right, and that's also good for self-esteem as well as the healing process.
Every person I put on here, the biggest smile on their face ever.
Yeah. So Bill, we're at 7 minutes and 25 seconds, and we're at 40% of your body weight, point of weight. How are we doing?
Feel fine. Feel good.
Great. We're gonna
get him to about 8 minutes. That's enough.
So.
All right. Time's coming to an end.
Time's coming to an end.
For today.
We're down to 0 on the treadmill, and we're going to start replacing his body weight. He's going to support his hands using his hands. So we're doing this slowly. Can you feel the weight coming back?
Yes.
Yeah. 80%.
You're gaining weight all of a sudden.
91%. And now fully back to 185 pounds. And we'll now cut the machine off. Better today than the first time?
Oh yeah, definitely.
Yeah, great.